preparing the live stream. If you want to start sharing.
Okay.
Yes, we are live.
Share my screen. Just a moment. There it is. Can you see my screen?
Yeah.
Yeah. Okay. So good morning, guys. I'm Natan Pereira, and I'm so thankful to have the opportunity to be here again to talk just a little bit about my thesis project. Today, I intend to talk about my third manuscript. Was second before, but now it's the third manuscript, and it's titled Years of Potential Life Lost. So for today, I choose other manuscript to discuss about the methodological approach, which is called Years of Potential Life Lost Due to COVID-19, according to race and color and gender in Brazil between 2020 and 2021. Ashley, you...
Yeah. Can you put it in the presentation mode?
Of course. Sorry.
That's okay.
It is now?
Perfect.
Oh, okay. Thank you. So let me hide the cams here. Oh, now I think it's good. So the selection of this article was not a random choose. I selected this one because two of these authors was judges of my qualification board exam. So the Edna Maria de Araújo and Ionara Magalhães de Souza are two researchers of violence and social and racial determinants of health in Brazil. So I took with Visolci, and we decided to bring this to that meeting today to see how Brazilians can demonstrate us and can use this methodological approach with Brazilian data, for example. So the objective of this study was to estimate the years of potential life lost, the IPLL, due to COVID-19 mortality in Brazil. So I put the QR code here in the slide, but I can put in the chat the link of the article as well. Let me see how I can do this. Someone can help me again. I don't know how I can access the chat.
To put the link in the chat, we can do that, yeah.
Yeah. Thank you very much. So, in that study, they did a descriptive ecological study, and they used data of the pandemic period, which consists between the March 2020 until December 2021. The outcome of this study was the years of potential life lost due to COVID-19, and they used some variables consisted in the Brazilian population estimates stratified by sex, age, and race and color. So the source of data was the mortality information system, the SIM, which belongs to the DataSUS, and some population informations derived from the Brazilian Institute of Geography and Statistics, the IBGE. So here, talking just a little bit about the statistical analysis they did in this study, the analysis consisted of 5 steps and can be divided in 5 equations, for example, because here we have a lot of values which means our results, for example. So in the first case, we have the total calculation of ANIPLL. So it's a lot of equations, and I really don't know how I can say this, but I put the equations here. And after that, I put a table comparing and talking just a little bit about what these equations what is the purpose of each one of these equations. So for the total calculation of ANI-PLL, this value represents the absolute impact of, in this case, COVID-19 on the loss of years of life lost in the Brazilian population. So this value indicates that a certain population groups has suffered a great burden of early mortality, for example.
Quinto. Ciao Riccardo, Nick and Nick.
So the second equation, we have the average APVP per death. I put the equation here as well, but this value measures how many years on average each person lost when they died from COVID-19 in this case. In the third one, it's the standardized PILL rate per 100,000 inhabitants. So here we have a value which represents the average age at which people died due to COVID-19. A lower or higher value indicates that mortality hit this group earlier, for example. Now, on the equation number 4, we have the rate standardized IPLL per 100,000 inhabitants. This value represents the years of life lost adjusted for the size of the population, allowing fair comparisons between different groups, for example. Groups with higher IPLL rate standardized, for example, shows that they suffered disproportionate losses in relation to their population size. And now the equation number 5, we have the standardized rate ratio IPLL. And a higher value here, this value means how many times a group has lost more years of life than another reference group. So here we have the ability to do some comparisons between groups. If a group has a ratio greater than another one, it means that it has lost more years of life than the reference group, for example. And it's important to mention some of these equations are related because we need some values to calculate for the calculation of another one. So here it's the table where I put some information that allows to comparison in which what each equation represents and the purpose of use of this. Oh, here it is. So in the first case, we have the total ANI-PLL, which represents the total years of life lost. It's like crude data, like a total number of deaths in each cases. And this purpose is to measure the absolute impact of premature mortality in a situation, for example. So in the second one, we have the median NAIPLL, which represents the average number of years lost per death. The purpose of use of this equation is to evaluate the average impact per individual. So the equation number 3 we use represents the estimates of IPLL for groups of different sizes. And we use when we are trying to adjust these values for population comparisons. The equation number 4, it's the ANI-PLL rate standardized, expresses IPLL per 100,000 inhabitants, and this allows comparisons between some populations. And the last one, it's the standardized rate ratio, measures how much one group loses years of life compared to another, and this allows us to compare specific groups in this case. So talking just a little bit about the results that they found that in their study. So here we have a table with the characterization of the participants of the study. So we can see here the mortality of COVID-19 was higher in males, in the age group 60 or more than this, white ones or black ones was the two higher indicators here, with a marital status married and elementary one level of education. Let me put the camera here. And the place of occurrence of these deaths was at the hospital. And this can be because a lot of these are hospitalized in the moment of the death because COVID-19. So here we have a graphic of the distribution of mortality due to COVID-19 and the division by sex. Let me just put the cameras here. Here it is. Now, so here it's just graphic ways to show the results of the study. And we can see the COVID-19 mortality divided by some groups. And here, of course, we can see that the white population have a lot of reports of death of COVID-19 and more years of potential life lost loses by this group. But we also have a higher indicators in the black and brown groupment because in some studies of health in Brazil, we are used to do this aggregation of black and brown, representing a major category because they consider, for example, that the black and brown individuals suffered of the same social conditions and ever situation of health. And here we have some tables that shows the percentage distribution of deaths due to COVID-19 and also the percentage distribution of IPLL due to COVID-19. So here, I just put some information, some underlines on some informations that I think it's important to discuss, because, for example, in the first one, we can see here that the black, browns, and black and browns individuals with age groups from 40 to 59, they show higher values, for example, compared to the white ones. In the white ones, the higher values was at the 18 and over group. And this represents, for example, that the vulnerable populations like the black population are dying before when compared to the white population here. So by some reason, the white population don't have the possibility to grow in node to die in higher age. And here we can see the percentage distribution of IPLL due to COVID-19, and the scenario is very similar here. But here we also have the white populations between the age of 40 to 59 years with a higher value when compared to another age groups, for example. So here we have here we also have the table 4, which shows us the total IPLL due to COVID-19. And here, it's important to mention that we have all of the race, skin, and color groups, but I put some informations only, I take some notes only in the black and brown, and the white ones, because on my study, my thesis project, for example, I don't intend to analyze the social determinants of health of another vulnerable groups, because I intend to focus only on the black and brown population and compare this to the white population situation of health, for example. So here, what we can see is that the black and brown population shows amount of years of potential life lost very similar to the white ones, because, for example, in Brazil, we have majority population being Black and brown, for example, about 56%. 56% of the population was Black and brown. So considering the another values, here we have the percentage of years of potential life lost per sex, for example, on which only represents this amount here, the percentage of the previous values here. And after that, we have the average rates of years of potential life lost. And here we have an important observation. We have the Black and browns with a lower indicator. So here we have the Black and brown being considered a population where the death comes first when compared to, sorry, we have a higher indicator of years of potential life lost when compared to the white ones. So here, in both cases, when we consider males and females, for example, we have, for example, the females, Black and browns, with 22.8 compared to the white ones, for example, with 20.4 average years of potential life lost. So this indicates us that the females in first and second group, there's a difference between 2 points between these two groups. And the same occurs when we look at the data of the male ones. So here with the males, we have 24.4 in the male Black and browns, and we have 22.5 when considered the male white ones. So this means that the Black population have worst indicators when considering the average years of potential life lost here.
Natan,
We also, sorry?
can I ask a question? Sorry to interrupt.
Of course.
So for them to calculate the potential life years lost, do they use like the standard life expectancy for that group?
Yeah.
Or is it something that is adjusted, like, so you are saying comparing sex, right? So do they take the life expectancy from the average life expectancy for Black and brown females and compare that for white females? Is that the case?
Yeah, in the equation to calculate the years of potential life loss, they consider the expectation of life at birth, yeah, and the moment where the people die. So in Brazil, we have the Black population with, for example, a lower life expectancy when compared to the white ones. So they considered these two values, for example, the moment when that individual dies and the life expectancy as well.
Okay. And with the average number for life years that you're showing, so essentially, so if it's 22.80, you're saying that if the person died because of COVID, this person on average died 22 years before this person would actually die.
Yeah.
Okay.
And we also have the average age at the moment of death of the population groups. So here we have the white population when we are considering females and males, a general group, we have higher indicators here. So we have a difference between 2 points comparing the Black and brown groups to the white ones. And this shows us that the white population have better indicators of health. For example, the Black and brown population suffers a lot of conditions before the COVID-19 diagnosis, for example, and they died before. Because the literature shows us that, for example, the Black population have difficulty to assess of health, We have a lot of studies that shows us the Black and brown populations don't have access to hospitals, for example, during the pandemic of COVID-19. So here we have a demonstration that the Black population in general, I will say the Black population because this is a group, we have here that the Black population died first when compared to the white ones. And of course, we cannot consider only this factor, only this indicator, but we need to look at all of the situation of health. But we know that the Black population suffers a lot of conditions that doesn't apply to the white populations as well. So here are represented here with a higher average age at death in the white group when compared to the Black ones. And here we have the IPLL rate as well. And we have the same situation here when compared to the white ones and the Black and brown. And for the IPLL rate ratio, we have the indicators, we have the comparison between some groups. And here the reference was the females white. And we have the ratios here that shows that the black and browns, females, males, and the white males have higher indicators of years of potential life lost. So they died earlier when compared to the reference group, which was the female whites. And I think here they use it, the female whites, because we know that, for example, the females have better indicators of health because a lot of factors as well. And in this case, in the Brazilian situation of health as well, we have the white females with better indicators of health, like happens in other scenarios in other countries, for example. So here we have the worst scenarios for the black and brown males, and which was very similar, for example, to the white males. So they show very similar indicators of years of potential life lost rate ratios. Well, and the main findings of this study shows us that, for example, here in this study, they estimate that 13 millions of years of life were lost due to COVID-19 in these 2 years. And we also have the two groups we have a prevalence of men's with 58%. And we have some groups that are most affected by the under 60, less than 60s, where the black and browns represents 58%, almost 58% of potential years of life lost. But we also have indigenous ones with 30.3% of potential years of life lost. And of course, this needs to be analyzed with a lot of considerations, but we can imagine this because of the access to health during the pandemic period, for example. And in the over 60s, we have the groups most affected were like the whites and yellows. And it's not a coincidence because we talk about this indicator, about these values on the table. So here we have the white population being able to grow in old, and we don't have the same conditions of growing old and have the health indicators applying to the other groups like the black and indigenous, for example. Oops, sorry. Oh. Yeah. So the COVID-19 has not affected all populations in the same way, where we can see the black and indigenous men died earlier and lost more years of life than other groups. We also have the finding that the racial and socioeconomic inequalities were a determining factor in the severity of the pandemic's impact. And this not only affects the population during the pandemic COVID-19, for example, we also have this happening in another situations like chronic conditions or another diseases. So the findings here highlight the importance of public policies that can be applied to the reality of the population, and some policies that can be wrote thinking on the situation of health of these populations. So why the Black populations don't have the same health conditions of the other ones? Why the COVID-19 pandemic was worst in the vulnerable population condition scenario, for example? So this population, even when we have some public policies focused on these minority group populations, we also have these populations being considered vulnerable to some health conditions when compared to the white population, to the other populations of the country. So why this kind of situations happens? And this, with these thoughts, it's that I wrote my objective. So I put here the name of my thesis again, Black Skin and My Voice, the Health of Young Black Brazilians from the Perspective of Necropolitics. So the necropolitics is, I will repeat today, but the necropolitics is my theoretical framework. And in this case, my specific objective was to verify the time series in years of potential life loss due to the socially determined disease in the young Black Brazilian population. So we have in 2024 the creation of the program Mais Brasil, where they intend to eradicate some diseases considered socially determined. And I will talk about the diseases later. But I intend to do this under the perspective of necropolitics lens, because the necropolitics theory says exactly this, that the Black population, it's not a coincidence that the Black population shows worst indicators of health, for example. So according to this theory, we have the Black population suffering of a condition of health because they state determined it. So here, I intend to do in my study an ecological longitudinal time series study with informations of the mortality in Brazil with between the period of January 1st, 2009 to December 2024. So I decided to use informations between this period because in 2009, we have the publication of the politics, a specific politics of health to the Black population health. In my study, the outcomes gonna be the years of potential life lost due to socially determined disease. So in the first study, we have the COVID-19, and here we have the socially determined disease. And we're gonna analyze the young Black Brazilians stratified by sex and disease category, because I'm gonna use the 14 diseases determined by the Ministry of Health, how the socially determined ones. So the data source of the informations will be the Mortality Information System, the SIM from DataSUS. And we're gonna use some expectancy populations from the annual population estimates from the IBDE and socioeconomic indicators from the continuous PNAD. So we're gonna use the same equations used in the first study. So the analysis will be carried out considering the total years of potential life lost, the average years of potential life lost per death and per year in this case, because we intend to analyze the time series. So here we need to see this by year. So we also intend to use the IPLL rate adjusted for the population size. And here, introducing the temporal aspect of the study for don't do a study very similar to the first one, we intend to carry it out Poisson regression as well. Because here, with this approach, we can do a count of rare events, like, for example, the deaths for due to the socially determined diseases. And with this, we will be able to evaluating trends of the mortality due to these diseases over time. So here we have a equation for the calculation of Poisson regression as well. And the value here will show us if we are going to have an increasing or a decreasing or a stable values of mortality of years of potential life lost mortality in the time, for example. And we also, with this approach, can include other variables like, for example, gender, disease, and see the results in a different perspectives. We also intend to show our results in a different way of the first study, for example, because in the first study, they don't have, they only have that graphic that I showed to you. But here we intend to show the years of potential life loss due to each cases in a, for example, graphic similar to this one, to see how the rates uh, uh, changes during this time of analysis. So here I put a table again with the first study and my study to just to comparison. So in my study, we intend to identify special patterns and, oh, sorry, here is, oh, no, here it's wrong. Here I completely forgot to change, but because this is the objective of my first presentation, but here it's right. It's right. So the period of study, it's the objective gonna be to identify the variation, the time series trends due to of years of potential life loss due to socially determined diseases in the Black youth population. The period is gonna be the 2015 to December 2024, according to availability of the notifications in information health systems. We have the population studied, the young Black Brazilians. So here we will do the junction, the groupment of Blacks and Browns in a bigger category, considering the same aspects of the COVID-19 study. It's stratified by sex and disease here, not by the same approach that the used in the COVID-19 study. The source of data gonna be the mortality information system, the IBD with the population estimates and continuous PNAD with socioeconomic indicators as well. The causes of death analyzed in the first study was the COVID-19 deaths, and here gonna be the socially determined diseases. And the socially determined diseases, according to the Ministry of Health, was malaria, Chagas disease, trachoma, lymphatic filariasis, esquistosomiasis, onchocerciasis, gel-helminthiasis, tuberculosis, leprosis, viral hepatitis, HIV and AIDS, syphilis, hepatitis B, and ATLV. And all of these diseases are in accord with some objectives of the Mundial Organization of Health, and they intend to eradicate or minimize the occurrence of deaths by these diseases until the year of 2030. So the dependent variable in the first case was the IPLL due to COVID-19. And in my study, we have the IPLL due to socially determined diseases among young Black Brazilians. So the individuals between the age of 13 to 24 years old. So independent variable in the first one was the sex, race and color and age group. Here gonna be the year of death, sex and disease category. And the years of potential life lost calculation gonna be at the same way for the both studies. But here in my study, we're gonna add the annual percentage change to measure, for example, the increasing, stable or decreasing trends of death in each cases during this time of analysis. So the analysis plan, we intend to do a descriptive statistics, a comparison of the rates, the rate ratios to quantify racial and gender disparities, for example. And here we need to look if we're gonna do a difference between the genders as well. The annual percentage change calculation, and we're gonna do this with Poisson regression to assess temporal trends and some tests for statistical significance of changes over time. And the results, the expected ones, in my case, it's the identification of increase in or decrease in our stable trends in the IPLL due to the socially determined disease. So talking about the expected results and some reflections, what I think we're gonna find with these results is an increased early mortality of young Black Brazilians by diseases that are considered avoidable. So we also can find some differentiation by gender and disease, because here we have the male ones, like in the results of the first study, for example. I think we're gonna have the male ones with a worse scenario of health, even when we consider the socially determined disease. So I think we're gonna find an increase in our stable trending IPLL over time, but I think in all of the cases gonna be an increase in HATES. And the identification of the main causes of IPLL, for example, in the young Black population groups. And this represents for us some gaps in public health policies, because even when we have some public policies specified to the Black population, we also continue having some avoidable diseases and some avoidable mortality occurring in the Brazilian scenario. Oops. And this can be associated with some structural inequality and its impact in health of some groups in Brazil, for example. And this will show us early mortality. And now, according to the necropolitics lens, the early mortality, like a tool or like a strategy of the state, for example, to eradicate some populational groups. So we don't have to kill this population, for example. So we have to act in the condition of health of some groups, or don't give conditions of health to some groups, and in this case, the Black population ones. Because this group are also considered vulnerable for some diseases, and we also have the disparities in access to health applied in this case. So when we have a population in precarious conditions, we have a population with the impossibility of growing old. So here we're gonna have the worst indicators, for example, for the Black young population. So we don't have olders, older Black population in Brazil. We only have the white ones, for example. And this also can be associated with the structural racism. And it's a main axis of the necropolitics, for example, like this structural racism can be observed in some policies, in some practices, and these apply also in the healthcare and health conditions, for example. So thank you so much for the opportunity again. And if anyone have any question, please go ahead. Thank you.
Yeah,
I don't know if I talk too fast, but
thank you, Nathan, for your presentation. It's a very interesting topic. But I have some two questions I would like you to clarify. The
Mhm.
first is, I don't know if in Brazil there is some kind of definition of who is white, who is black, and who is brown.
Mhm.
And then secondly, um, I understand that you are using an ecological design, so I would love to know more why you choose to carry on this study as an ecological study.
Okay, so in Brazil, we have a census that are applied by the Brazilian Institute of Geography and Statistics. So we have a characterization of our population into these groups. The race in Brazil is auto-identification. So we have the consideration of population. So we have the informations of categorization in the white, blacks, and browns. But most of studies in Brazil consider that the blacks and browns suffer of the same health problems, for example, and in other aspects as well. So it's because of this that I am doing a group, a major group, with those two races, for example, the blacks and browns in a only group. But we have this classification. We have informations of characterization of our population from 2010, and now we have a new census, a new categorization of our population, and I intend to use this. I don't know if it's possible to use because we don't have total results in information system. But if it was possible, we intend to use these informations about the categorization of population with new informations, with new observations, for example, because with using this, we're gonna have an understanding of the real situation of Brazilian population and how many individuals are considered white ones, or how many individuals are considered the black ones and the brown ones. I don't know if I answer your question, your first question.
Maybe I'm the one who didn't understand you right, but what I was basically asking is, do I just decide that I'm brown or I'm black or I'm white, or is there a system that says I am black or I'm brown or white?
Basically the census is an interviews, and we have, for example, a person who goes in some homes and asking the population. So they don't ask this for all of the populations. For example, in my case, personal experience right now. When I was in Maringá, I lived in a building, a condominium, and we have a professional of the Brazilian Institute of Geography and Statistics. And this person goes for some buildings and they ask for residents of these places. And they do some questions about, for example, the education status, the marital status, and race and color, the income. And they do a measure based on the most available answers to categorize and to understand what is the situation of the Brazilian population as well. Of course, they don't do this with all of the population because it's impossible to do this, but they do with most of people answering the questionnaire to understand the real situation of racial groups, for example. So in this information system, for example, we have the classification of the population. So it's because this, for example, that we have in Brazilian scenario, we have most individuals considered blacks and browns compared to the white ones. But it's really hard to talk about this because we don't have we are used to in the past to do some classifications based on the phenotypic aspects, for example, but how race is considered like auto-identification variable, we need to follow what the people answer on the questionnaire, for example.
Natan, great presentation.
Thank
I also have a question. So you are looking. So you told us about some of the conditions, some of the diseases you're looking to investigate the years of life lost.
Mhm.
And to compare that to the life expectancy of those populations. I know that this is probably not going to have an answer, but if you are using the life expectancy of vulnerable groups, as you're saying,
Mhm.
Black and Brown and Indigenous, their
Mhm.
life expectancy is probably already lower
Mhm.
than whites. So essentially, already you, you are already considering something that is they already have lower life expectancy, and because of the diseases, they're going to have even lower than what is expected.
Mhm.
Is there a way that the authors describe for the COVID paper on how to mitigate that? Or
Yeah.
I don't know.
Yeah, in the COVID paper, for example, they do a categorization and they selected, let me look here. I think they selected the 85 years. Let me check this information, João.
Okay.
But they put some informations about the 87.9 years were stipulated like the upper limits to calculate the IPLL, for example. So here we need to consider, of course, that the Black populations have shows lower life expectancy. Yeah, I understand. Now Bali put in the chat the confounding effect or modification. And we need to define as well. Of course, all of my studies are being delimited, and we are seeing how variables, which variables we are being considered for study, for example. But in this case, we need to look with more careful to this situation because, of course, when we consider that the Black populations have uh, lowers life expectancy, we cannot compare, for example, because of course the Black populations gonna be show the worst indicators of health and worst scenarios, for example. So I think here what we need to do is to define, for example, a median. I don't know if it's possible, methodological, talking about the methodological approach, to do a median between the Black life expectancy and the white ones to do like, I don't know, an average between the two life expectancies and analyze all of the situations with this value. But I
Yeah,
need
I
to
would
check
think
if it's
of
possible.
something like a sensitivity analysis where if there are any publications that describe what would be the actual expectancy
Mhm.
for the Black or vulnerable populations, maybe it's not the same as the white, or I don't know. Of course, there are biological differences, but they are minor, right? Here we're talking
Mhm.
about the social determinants, how does this impact life? So maybe doing this second comparison with, okay, uh, in reality, the Black and brown population live on average 10 years less than the white, but we
Mhm.
would expect that this difference would be much lower. So you do a comparison with what you have versus what you would expect based on these estimates. I don't know.
And also, what
Something,
we can do as well, it's just to considering only the Black population, for example, because here uh, it's not the comparison, for example, if we decide only to see the Black young populations, we only gonna have, for example, the expectancy of the Black ones, and we're gonna see only the years of potential life lost by the Black population and not
Yeah.
comparison to the white ones, for example. So
Yeah.
here is a discussion, and we need to discuss about this to decide what we're gonna use, like the life expectancy, and if we're gonna compare the white ones with the Black ones, or just to see, for example, that the Black ones are suffering with amount of X years of potential life lost, for example, without to comparison with the other groups, for example, and to compare only between the males and the females, for example. I don't know.
So one other point that I think was in part of Schwab Victor's original question gets to like almost this proportionality, which I don't see how it's reflected, like in the summary. At least you could kind of gather some information from the way it's presented in the tables, but to think about it, I think about, like he's saying, you know, if the life expectancy is already different, and then you're saying they're having greater impact on top of that, I almost wonder if it's like, if some people are measuring, like, instead of years of potential life loss, like proportional years of potential life loss. For example, if the life expectancy is 100 and you lose 10 years of that, okay, that's 10% of the potential life years lost. But if your life expectancy was only 80%, 80 years to begin with, and you lost 10 years or even more, if it's disproportionate, that's a greater than 10% years of life loss. I don't know that I've ever seen that done, but it would get to some of the disproportionality and show that it's even more of an impact. I think one way that people do something that's like this, which you can debate over the moral question, is getting it into like earning loss, or like productivity in terms of their working years, because you could even argue too that when folks lose those younger years of life, that those folks have more earning potential financially, and so that's disproportionate as well. Whereas if another population is losing the years of the 70s and 80s, it's not the same in terms of the financial impact. Those are just like some stream of consciousness thoughts for you guys.
Yeah, but of course, makes sense. Makes sense. Yeah, I was talking a lot with Natan Nascimento, for example, and João Viçosi about this article, and we have a lot of points to discuss before we follow with the analysis, with the variables and the data and something like that. And also the socially determined diseases, for example, for me, it's a new list because it was created on this list. Socially determined disease was created on the last year, for example. And here we have some diseases that I confess to you that I don't know what it is. And we need to look at the data to see if we have some informations about deaths, about these diseases as well. So I don't look at the data as well to see if we have an amount considered a significant amount of notifications of reports by deaths of these diseases. But of course, we can do some changes to have a good results, for example. And we also can analyze other diseases or remove some of these diseases or.
Well, and also some of these points that we're raising doesn't necessarily mean that you have to change your analysis, but maybe those are things you end up noting in a discussion, just other considerations.
Yeah.
Yeah.
Questions?
Well, I think this wraps up our session. Thank you, Natan, for the great presentation. Thank you all for coming and for interacting. This recording is going to be on YouTube, so you guys can always go there and look and share with your friends, colleagues. But I'll also have the link on the Gemini spreadsheet for the data science meeting schedule. Thank you all for coming. See each other again next week.
Thank you, guys. Have a good one.